Good afternoon, everybody, and thank you for joining us. I am Adam Buckles, Head of Legacy Fundraising here at Alzheimer Society. Please do pop where you're coming from, where you're joining us from in the chat menu today. Let's make sure that's working as well for the Q&A later on. We've got a sunny Nottinghamshire. Thank you, Rachel. Lovely to see. I'm in a not too sunny Hampshire at the moment, so a little bit further down. We've got Kent on there as well. Fantastic. Hopefully, we've got Wales. Wow, we are literally ticking all the UK boxes there, which is fantastic. And Oldham, Manchester, brilliant. Thank you, everyone. We will be starting just a few moments. We're just doing the usual, making sure that you're all online before we get sunny and started. And not so sunny Leicestershire. I'm sorry to hear that, Nikki. Hopefully we'll get some sunshine in a not too distant future. Well, look, we're ready to almost get started. A few more people kind of joining us, but let's kick off today because I know we've got a really busy session. I'm really looking forward to taking you on a pretty special journey today. So thank you for joining us this lunchtime for the virtual lab tour of the Care and Technology Centre. The centre is part of the UK Dementia Research Institute, or the DRI as we tend to call it, because it can be a little bit of a mouthful. And thanks to generous supporters like you, since 2018, we've been able to invest £6 million into the UK DRI and have actually committed a further 6.5 million over the next 5 years, which is, I think you can all agree, a phenomenal achievement. But I'd just like to take a moment to say thank you, and a huge thank you to you. Whether you are a regular supporter of ours, one of our amazing corporate partners, whether you've left a gift in your will, or in fact support us in any other way, the research happening at the UK DRI is a perfect example of why, our commitment and how your support are helping to create a world where dementia no longer devastates lives. I'm now going to hand you over to Sian, who's our host for today, and she's going to explain why this research is so vital and what you will see today at the centre. So I hope you enjoyed today's tour, and I will see you a little bit later on. Sian, over to you.
Thanks, Adam. So my name is Sian Gregory. I'm Research Communications Manager at Alzheimer Society. And today what I want you to do is I want you to imagine a world where smart technology in the home can really learn the habits and the routines of people living with dementia, where smart technology can remind people living with dementia to eat and to drink regularly during the day, or it can monitor their heart rate and their distress for any adverse symptoms. Crucially, where this technology could maybe help keep a person safe, where it could help turn off an oven where someone with dementia may have forgotten to turn off that oven and keep them safe at home. This technology could identify infections, it could identify disturbances in a person's sleep or any changes in their behaviour. And then what we could do is tailor a person's care and adapt it to their changing needs, as we know is so crucial in dementia. And crucially, what this technology would be able to do is it would be able to help people living with dementia stay at home in their own home for as long as possible and do that safely. Now, what I've just described sounds really futuristic, but thanks to research, it's absolutely possible. And today what we're going to do is we're going to transport you virtually to our Care Research and Technology Centre, which is a fantastic centre that brings together world-class engineers, doctors, researchers, together with people affected by dementia to enable us to develop this kind of technology that I've been talking about. We know that social care for people living with dementia, sadly, is a postcode lottery. And what that means is that there is a huge number of people who are facing dementia alone or facing it with their loved ones, but they're living in homes that are not adapted to the changing needs that come with living with dementia. And therefore, they have insufficient access to support, care, and guidance. And a piece of Alzheimer Society funded research found that 41% of people are not at all confident when they are either managing their own or their loved one's dementia. And one carer really poignantly told us that the pressure I feel under to keep everything ticking along, like medication, appointments, making sure that my husband is safe and cared for, and also maintaining some quality of life, is exhausting. And unfortunately, this mirrors the experience that is facing thousands of carers in the UK today. And despite carers' best efforts, there is a lack of adequate support, and that often results in people living with dementia reaching a crisis point and therefore having to be admitted into hospital. And a staggering 1 in 4 NHS hospital beds are occupied by a person living with dementia. And 9 out of 10 of those admissions are of people living with dementia who are living in their own homes. And we think that at least 20% of these admissions are avoidable. They're caused by different things, whether that's by dehydration, malnourishment, urinary tract infections, or falls. And these avoidable admissions can have a devastating impact on the person living with dementia who's been admitted to hospital and on their family. Hospital environments are sadly often not dementia friendly, and that can cause a lot of distress, and it can lead to symptoms being missed or being left untreated. And one NHS consultant has told us that the avoidance of unnecessary hospital admissions should be a pillar of living with dementia. I've rarely seen people go into hospital and come out better than they went in. They can come out worse in terms of their functional ability, and those who stay longer than a few days universally come out worse. People with dementia and their carers desperately need improvements to the care and support that they receive at home. And today you're going to enjoy an exclusive live tour of the Living Lab at the Care Research and Technology Centre at the UK Dementia Research Institute, which is going to be led by the centre's director, Professor Dave Sharp. And he's going to explain how the technology that I've just discussed is being developed right now, and crucially, how he and his team are working with people affected by dementia and keeping them at the heart of this research. So to tell you more about this exciting project, I'm now delighted to introduce Professor Dave Sharp. Welcome, Dave. I'm going to hand over to you.
Sean, thank you very much. Can you hear me now? Yeah, I'm Dave Sharp. I'm ringing from West London. It's great to have you all here. Thank you very much for joining. We've got some slides. I don't know whether it's possible to share those. What our work is trying to do is to work out how we use technology to improve quality of life. And we are one of 7 main centres within the UK DRI. The centre I lead is called Care Research and Technology, and we have a kind of special place, I think, within the Institute, in that we're really focused on people who are living with dementia and affected by dementia. And we're using new technologies to try and improve quality of life. So our mission is really to transform dementia care through the use of new technologies. And as you've already heard, we were partly kind of inspired really by Alzheimer Society work, which recognised that the vast majority of people would like to stay in their own homes for as long as possible. But the flip side is that we have an awful lot of people who end up in hospital or end up perhaps prematurely in care homes. 1 in 4 of our hospital beds is taken up by people living with dementia, which is an enormous number. And as you've heard, we think that quite a lot of those admissions are avoidable. And what we need to do is to work out the way that we can augment, not replace, but augment the kind of care that people receive already. And we make that more efficient or make better use of the staff that's available. So you can see on the top some of the what we call our Minder champions, so the people we're really working really closely on to develop the system. And our goals are really to focus on the things that matter most to people living with dementia. So we'd like to be able to personalise their care. We'd like to be able to do things like reduce sleep disturbance, which is such a major problem for many people affected by dementia. We want to be able to identify infections and other medical problems that are occurring and often leading to crises. And we want to kind of deal with things like agitation and aggression that often are very disruptive for patients with dementia and their families. We have a very unusual set of researchers at Imperial. This is the team. I'm not going to go through everybody, but this is a highly multidisciplinary team. So as you all know, Imperial has an amazing range of engineers, computer scientists. They're doing incredible work. But what we're doing within the centre, we're focusing that expertise on key problems for people living with dementia. So we have a whole range of scientists. I'll just pick out 1 or 2 people. For example, Tim Constantidou is in the electrical engineering department, and he's developing radar for use in the home. And we'll show you a little bit of that later on, which is an incredible new technology that's going to, I think, transform some aspects of our care. We have Paul Fremont, who's a synthetic biologist. He's developing new ways that we can diagnose infections in the home, so new point of care diagnostics. And we're bringing this all together with lots of input from people affected by dementia, led by our Helix team, who lead a kind of human-centered design process. And then we have a health and social care translation team within the centre that kind of focuses our work on the things that matter most. So at the heart of what we're doing is we're putting new technologies into people's homes in unobtrusive ways that are acceptable, and we're collecting a range of information that can be used to improve people's lives affected by dementia. So we can have new ways of monitoring, for example, sleep or infections. We can look at the ways people are using medication, how that's affecting their lives. And that data is all put together in the cloud. And we're using machine learning and artificial intelligence techniques to identify signals that are of most value from a clinical point of view. So we can generate alerts, for example, of when you might be developing an infection, or potentially not drinking enough, or maybe wandering outside at night. And these things are then used to guide our monitoring team. So this, what we're doing is not replacing people, but we're using it to guide personalized interventions. So this is a system that's in place at the moment. We've developed, we're running this as a large scale pilot, and we're really at the position where we can kind of translate that into the NHS and into social care at a much larger scale. I'll just say a little bit about the process that we're going through. So we identify a kind of clinical or care problem. That's our starting point. If necessary, we develop new technologies, but that's not always required. Right? So we're validating the technology. So is the technology fit for purpose for people affected by dementia? And then we're doing clinical studies. So we're in the real world, in hospitals, in patients' homes, and we're using that to really work out what technology is most effective and what can be used in the real world. And at all of those stages, it's a kind of partnership, if you like, between clinicians like myself who are looking after people affected by dementia, scientists and engineers, designers who are making, I think, the system that is fit for purpose, and then also people affected by dementia who are contributing at all the points in our process. So we end up with something that's acceptable and people like and they want to use and want to work with us on. So this is Afzal and Zora, who've been with us now for a number of years. So they've been part of the project, helping us with the design of the system. I think it kind of representative of their views of how many people feel about the system. And in general, I think there's a real feeling that this kind of system is providing reassurance. As you heard from Sean, I think people often feel quite neglected, or they feel kind of disconnected from the health and social care teams. And what we're doing here, I think, is providing another layer of reassurance and an interaction that people feel is really helpful often. And I think we've got a great video, I think, that summarizes people's views on this. So there's a link to at the bottom that we could circulate if people are interested in. The general feeling, I think, is that we're both providing important medical information, but I think for people affected by dementia themselves, we're providing reassurance and support that improves their experience. And in the end, what we want to do is to support people to stay at home for as long as possible. This is our Helix teams. These are our designers working with people affected by dementia. And a big part of what we're doing, I think, is to make sure that our systems are inclusive. So as you heard highlighted from Sean, we're often in a bit of a postcode lottery. It's very variable about who gets what. And I think what we're keen on doing is generating a system that's cost effective, but also available for all, and is formulated in a way that works for everybody. So I think I'll stop there. And then what we can do is show you around a little bit of our living lab and show you some of the technology in action.
So Dave is going to be getting set up now for the live tour. Before that, we've got a sneak preview of the entire Care and Technology Centre. So we're going to play that video for you now, and you can sit back, relax, and then we'll take you straight to the lab.
Well, I think dementia is one of the great challenges of our time.
My own grandmother had dementia, and when I think about it, pretty much my family felt helpless about it. I get emotional.
It's okay.
I've been doing sleep research for the past 40 years. In dementia, we see very strong changes in brain function and we see quite pronounced changes in sleep.
The biggest challenge facing dementia research today is about changing the attitude and culture towards dementia research.
I feel there is a lot research can do to help and support people living with dementia and their families, and also by doing so help the healthcare services to cope with the demand and provide better and more effective care.
So the UK DRI brings together some of the world's foremost dementia researchers. We're focused on supporting people who are living with dementia to live as well as possible and for as long as possible in their own homes.
In 10 years' time, dementia research will take place primarily in the homes of people living with dementia. It is now much easier to do research at home. We have new digital technologies. We have internet data collection platforms and integration platforms. And by conducting research in the community, we will make it, on the one hand, easier for people to participate in that research, and on the other hand, it will be much easier to do large-scale studies.
The work that we're doing within the centre is using new technologies to allow us to support and understand the effect of dementia in the home. So this is taking care into people's homes to allow us to deliver more active, proactive care, understand when problems are developing and support people living at home. And I think we've got tremendous kind of opportunities using a range of new technologies to do that. So it's a very exciting time to be working in this area.
Fantastic. Right. Well, we can now introduce or reintroduce Professor Dave Sharp from the Living Lab. And we've also got the fantastic UK DRI emerging leader, Dr. Shlomi Har, with us as well. And they're going to be giving us a tour of the Living Lab. So over to you, Dave and Shlomi.
So I'm here with Shlomi Har, who's my colleague within the centre. Shlomi is an engineer and neuroscientist. So I suppose we represent the clinical kind of neuroscience side of things.
So the first thing is simply a door sensor. We know whenever the people get in and out of their house, we can use it to design algorithms to know if they are leaving the house at night, if there is anything that we need to worry about. We track their use of the kitchen in order to know their meal schedule. So we have another door sensor for their fridge door. We have smart plugs for their kitchen appliances. Very simple device that can simply tell us whenever they turn the kettle on, the toaster on, so we can know how they eat. We have motion sensors around the house. Those are simple passive infrared, the same one that you'll have for a burglar alarm system. We have it in the different rooms of the house, so we can see how people move around the house. It gives us a pattern of activity in the house, but more of it gives us any changes from the activity that can be very meaningful for clinicians. Right, Dave?
What's kind of interesting about these devices, I mean, they're very low cost, they're not obtrusive, and when you put those information together, so it's actually the individual pieces of information, like whether the door opening and closes is perhaps not so informative, but when you put it all together in a single package, that can provide a very important, informative, rich description of what's going on that can be extremely helpful.
So moving on from the environmental sensors that capturing everything in the house, we want to capture the patient himself. And the simplest, but perhaps most informative device that we have at the moment is this bed mat, going under their bed. If they're sharing a bed, it's in the patient's side, so we're really capturing their activity. This sensor not only gives us an indication when they're in and out of the bed, but give us full physiology during the night. We can see the respiration and heart rate throughout the night. And with that very simple sensor, but very informative one, we're getting physiology few hours a day, every day, that Dave and his team are already capturing very meaningful insight out of.
Yeah, so again on the kind of clinical side, it's surprising how much information that's relevant to patient care you can get from a simple sensor like this. One of the really key things about this kind of technology is it doesn't really require people to interact with it. we could, I'm wearing a smartwatch which gives us some of the same kind of information, but actually for people affected by dementia that can be quite challenging to use. Whereas if you think about the bed mat, it's giving us things like heart rate, respiratory rate, and if we think about COVID, we've been very interested in identifying people who might be developing COVID, which unfortunately affects lots of people affected by dementia, and we can identify the early signs of COVID from the bed mat because we can track the respiratory rate, so the breathing rate, which actually starts to increase as COVID develops. And so this is a very effective way to identify the early signs of infection. And we think that this is going to potentially transform the way that we can identify these early signs of infection that then often lead to crises within the home. Shlomi. Yeah.
So as mentioned, we try to use passive sensors, all the environmental one under the bed, nothing that the patient need to interact for. But we are aware of the added value of a wearable. And we recently started a collaboration with Milbotics, which is a small British startup that develops smart socks. So the socks is a regular socks that can be washed, the sensor can be recharged, and this kind of wearable has the potential to be worn by people living with dementia on their daily living. This company is being supported by the Alzheimer Society as well, and we are currently in an investment route to release an Innovate UK grant with them in order to deploy their sensor in our cohort. Moving from wearables back to passive sensors, Dave mentioned before a radar device that we're working on the development. This is being led by electrical engineering members in our team, led by Professor Tim Constantino. The radar device is simple small sensor like those two that are prototypes that we are developing. It's sensitive to very small movement, small enough to feel to measure respiration or even heartbeat, but it also can measure full body movement, moving around. So, a little example that we have here is an algorithm was developed by the team for tracking gait, seeing how people walk. We can have simple sensor like this radar, which is very inexpensive, in the home of the patient, in a corridor, for example, and every time that they walk up and down the corridor, we can get the full statistics of their gait. We can see the walking speed, step length, and we can see how it changes over time. That gives us a good measurement to see frailty, increased risk for falls, but also to track their general state of and well-being from tracking their gait.
Yeah, and again on the clinical side, I mean, one thing we're very focused on is the risk of falls. Obviously, this is incredibly problematic for many people affected by dementia and often leads people to be admitted to hospital. We need a better way of identifying falls in the home if people are living on their own or they're socially isolated. We had a 94-year-old lady who has been in our study. Unfortunately, she's passed away now, but she was in our study for a number of years, and she lived on her own. She was desperate to stay at home, but she unfortunately fell quite frequently. And the standard at the moment is to use a pendant alarm. So this is a device that you wear around your neck, and somebody has to press the button. So an individual has to remember to wear the alarm and also press the button if they fall. And unfortunately, she would repeatedly fall but never press the button. So she would never nobody would ever know that she was having that problem. Whereas with our technologies, we can identify that in a way that doesn't require an individual to actually signal it themselves. And I think in the end, this will be a kind of step change in the way that we can keep people safe in their homes.
So with the radar, we can see how people walk at the home, but we have a very low resolution of their movement. In parallel, we're working on the use of cameras for a full resolution of the movement. Now you can see our cameraman. So here with a simple camera that have a depth sensor, we can reconstruct full body skeletons of the people that are in the frame. With such a camera in the home, we don't need to stream any video from the home. We can reconstruct their body, see their posture, see changes in their movement, extract specific features of them, and keep track of those. Think, for example, on rising from a chair, something that we all do many times a day. If we are less stable, more frail, it will take us longer, we'll need our arms more, it will take us longer to take the first step. Those are simple features that we can extract from such a frame and we can track only those features, how they change over time to address frailty, risk of fall, and so on, with a device that is commercial, that can be deployed in the home with smart algorithms in order to enable us to track the changes of the posture and stability of the patients in a very accurate way.
So perhaps just to finish off, I hope you've got an idea of the kind of activities we're doing. As some of this is right now, it's in the real world, it's providing with really important information. Some of it is in development. All of it has been really developed with people affected by dementia, with their involvement, with their engagement, and we are, really kind of keen, and it's central to what we're doing, is that we want to develop technology that people are comfortable with. So we don't want this to be overly intrusive. We don't want people to feel as though people are watching them from afar. What we're doing is trying to deploy technologies that support people, that provide reassurance, and we're working with a wide range of individuals to make that the best system that it possibly can be. So this has been developed with significant input from the Alzheimer Society, and it's great that you're here and we can share some of the fruits of what we've done. But we're at a stage now where we need to kind of extend the work. We need to get out into more people's homes. We need to work with a bigger pool of individuals, and we need to test this in the real world. So we'll need we'll need support with that moving forward, and hopefully we can do that with the Alzheimer Society partnership. Thank you very much.
Thank you so much, Dave and Shlomi. That was a fantastic view of the different types of technology that are available in the Living Lab and how they're being developed. I think one of the things that really struck me was how, as Dave was saying and Shlomi was explaining, this is such a passive way of collecting data. So this is a way that really we can do it in an inintrusive way for people affected by dementia. There's a huge host of information that we can use, but crucially, we're not asking people to do anything apart from go about their daily lives, which I think is really, really important. So I think we are ready to hand over to a question and answer session now for the rest of the session. So we have myself and Dave ready to answer your questions. So if you do have questions for us, if you'd like to pop those in the Q&A box so that we can get to those, and we will answer as many as we can in the time that we have available. So I am joined again by Dave. Sorry, Dave, for making you get up and down a lot for today's session. So let me just open up our Q&A box so I can see. But I guess a quick question from me, Dave, while we wait for people to submit their own. What for you has been the most surprising thing that's come out of the work you've done so far at the Care and Research and Technology Centre?
I think the degree to which people, have really engaged with the work that's being done. So the degree, the enthusiasm, I think, that people have who are affected by dementia have greeted the work. I think. Generally, there's real positivity about it. There's a recognition that we've got the technological tools to do some of this stuff. What we've got to work out is the best way to deploy them, and also how we use it to enhance the activity of the NHS, but also social care teams. Because we're in a challenging situation, where we don't have all the people resource that we need, and we need to kind of find a new way to deliver high quality care to a wide range of people, and I suppose that's what we're trying to do fundamentally.
It's fantastic that people have been so enthusiastic and engaged with the research as well. So we've got another question from Hugh, which is, how big a part does artificial intelligence play, or could it play, in this area of research?
Yes, that's a great question. So, I mean, I didn't dwell on that too much, but if you think about what we're doing, even with the relatively simple sensors, these are sensors that are bringing us information from individuals 24 hours a day, 7 days a week, all year round. One of the challenges is actually we just have a lot of data. So it becomes a kind of what we've got, a data science challenge, and to make sense of that data, to turn raw data into information. So into information that a clinical team or a social care team would like to use, that requires machine learning, artificial intelligence. So we have very sophisticated, I think, kind of approaches to that. We have a whole team of people working on that, and they're producing ways in which we identify what's, the needle in the haystack, if you like. When something happens that we really need to know about, we can't do that manually. We've got to kind of have an automated approach to that, and that's where the machine learning AI comes into it.
A fantastic tool that I guess has exploded in all of our minds with the explosion in AI being used commonly. So the fact that it can have such power in research is fantastic. Okay, we've got another question from Michael saying, do we have any commercial partners that are lined up in terms of the different devices that you're using in the Living Lab?
Yeah, so we, so as I said, if you remember the kind of the funny circle slide, the middle bit was if sensors are being made already, then we're working with those companies. So we have some commercial partnerships we're working with a company called Withings, which is a French company. Actually, they make the bed mat, they make some of our other devices, and they make some great kit that people like to use and is easy to deploy. So we're working with them. As I say, if necessary, we're developing technology, but our preference is not to have to do that. We just want to, we want to get to the benefit for individuals as quickly as possible. So we'll work with partners in doing that.
No, I think that's such a fantastic approach for the Care and Tech Centre, that we're using existing technology, and then where there's the gap, identifying where the new technology can come in. Is such a combination approach. Okay, we've got a couple of questions from Michael and Paul around privacy, so I'm going to amalgamate them into one. So how do we protect privacy with this kind of data? I know we've touched on it a little bit, but also how do we protect that privacy, but also use the technology and the artificial intelligence to help people as well?
Yeah, so it's a great question, and it's something that's very central to our approach. So, I mean, part of the approach is to really work with individuals affected by dementia and generate systems that are appropriate and acceptable. I mean, on the privacy issue, we're working to very strict kind of guidelines and regulations. So we work within the NHS kind of guidelines in terms of data privacy. So we're very conscious that we don't want data to be available to somebody who shouldn't see it. So that's taken as a given, if you like, of how we're operating. We also we want to get the minimal amount of data on people that's necessary. So a good example of that is the say that the cameras that we briefly showed you. So our system actually currently doesn't have any cameras. So we're not using cameras in people's homes. I can see a situation where we might want to do that in certain cases, but what we do there is we wouldn't sort of stream or kind of take out the actual images. The processing of the images will be done in someone's home, and all we get is some coordinates, if you like, some numbers, that wouldn't be identifiable. And I think going forward, that's the way that we need to think about this. We need more and more control of our own data, not just in this area, but in every area. And actually more and more, I think we'll have an understanding ourselves about how we do that. You probably, with your Apple phone, you probably get the alerts that say, do you want to share this data or not? And I think more and more you'll be given, the option of protecting privacy. And that's certainly the direction we're taking. We want to have as little data as possible, but to have the data that really matters for their clinical care. And I think when you talk to individuals who are struggling with dementia and struggling at home, what they want is they want to be cared for better. And if having a bit more information about if they're not drinking or if they've fallen or whatever, if that's what it takes to do that, then in general people are very, very comfortable with sharing that data with the right people. As long as it's the clinical care teams or the social care teams. I think that's how we need to develop the systems that's mindful of that privacy requirement.
No, I think that is another testament to how person-centered the design is as well, in that you're working with people affected by dementia and taking in their needs into account, that need for care and also that need for privacy. So thank you. Okay, we've got so many questions to get through. Thank you. Thank you, everybody. So I think we've got a couple of questions around this theme about if the system detects a problem, so for example, a person falling or an infection, how would that then be taken forward in the system to make sure that person gets the care that they need?
Yeah, so that's a great question, and so within our research project at the moment, so we have a monitoring team. So we have physical people who are sitting together and who provide the monitoring. And so what happens is an alert comes in. It says you've got a 70% probability of having a urinary tract infection. That team will then act on that bit of information. They'll contact the general practitioner or they'll contact the individuals, and we will action a response to that. I think moving forward, there's a shift. There's quite a big shift within the NHS as a whole towards having these kind of services embedded in the NHS, which is a different way of working actually. So at Imperial, we have what's called a digital hub, which actually cuts across, a whole range of different medical specialties. And that digital hub provides sort of monitoring of various types of people living at home. So, for example, if you have heart failure and we want to work out how to titrate your medication, we'll measure things like your weight remotely and then provide advice. And there's also a big move towards what's called virtual wards, which is, if we can discharge you a little bit earlier from hospital and actually look after you in the home, then we can do that safely. Now, where we're going with this technology is we want to embed that, within the NHS and also within the social care teams, and we want to effectively digitize, the existing care services. So, and in fact, that's exactly where we are right at the moment. Is our next phase of work is all about how we take the current system, our Minder system, and then we insert it into the developing NHS systems, because I think that's the way we're going to transform things at a larger scale.
That actually takes me on wonderfully to, I think, the final question we're going to have time for, which is an amalgamation. Again, we've got a few questions about geography and where this work is happening. So I guess my last question, Dave, is how widespread is this work currently in terms of where it is, and also what would your dreams be in that implementation, that rollout? How quickly do you think we could roll this out? A horrible question to end on.
No, great question, because that's what we our motivation is to get into as large a number of homes as possible, as quickly as possible. And where is it at the moment? We're in Surrey and Borders, so around Surrey, and then we're in West London. So we have two main sites which cover quite wide geographical areas actually, and they cover a wide range of different sort of backgrounds, different types of homes, those sort of things. And so we're doing that at a reasonable scale. Moving forward, the next stage is that we go to a larger number of people, and we do that in the context of an NHS and social care provision. And I think the thing we're often asked for people who fund this kind of stuff is they want to know exactly how much it costs, and in the end, they want to know, is it cost effective? Is this a good thing to do because we're going to save money in some other ways? And ultimately, we've got to provide the evidence for that. We have a system, but our job is to provide high quality evidence that will convince the funders and the regulators that this is a sensible thing to do. And so that's what we're engaged in. And that's our next mission, if you like, is to take the system and to really do the trials that are necessary to change practice. And that's what we'd like to do next.
I think that would be fantastic to see more widespread use of this kind of technology. And I think one thing that we've really had from today's session is just how, although this feels very futuristic, just how tangible this technology is and how it's moving at pace as well. So thank you so much, Dave, for your time today, for walking us through everything so brilliantly. And a huge thank you to Shlomi as well for giving us such a brilliant rundown of all the technology in the lab. You have shared some fantastic research with us today, and I know myself and everybody in the audience have really enjoyed it. So thank you, and all of the best of luck with the future work and the rollout as much as possible. So I'm going to now hand back to Adam, who's going to wrap us up for the session.
Thanks so much, Sian, for your time today, and as always for being a fantastic host. And a big thank you again, also from myself, but I know from everybody else on the call today, to Professor Dave Sharp and Shlomi for such an amazing talk. As someone who not only works for Alzheimer Society, but has personal experience within my family of dementia as well, it's fantastic to see some of these kind of technological breakthroughs, and we can definitely see the real-time implications of that. So I hope all of you have enjoyed having an exclusive insight into the Care and Research Technology Centre today, and also also that you are as excited as we are at some of the innovation happening right now. This is obviously just one of the pieces of research taking place at the UK Dementia Research Institute. And as mentioned, since 2018, we've been able to invest £6 million into the UK DRI, with a further 6.5 over the next 5 years. So there will be many more exciting research projects happening. So please do follow the link in the chat to read more. And I know there's some fascinating reading in there already. We hope this tour left you inspired by the future of dementia research. But as always, feedback is vitally important to everything that we do. So if you could kindly take a moment to complete the short survey that will pop up at the end of this event, this will really help us to improve our future events. And as always, will be very much appreciated. These exciting advancements simply would not be possible without generous supporters like you, who are committed to creating a world where dementia no longer devastates lives. Therefore, the survey will also include the chance to say if you would be interested in learning about how you can continue to support more areas of research. You can also speak to, obviously, your Alzheimer's Society contact, who can help you with any questions you may have, and can discuss your support with you to make sure that we can focus it on the areas that make the greatest difference. So I'd like to say a huge thank you on behalf of all of us here at Alzheimer's Society, and the people that your support is helping now and in the future. So thank you for joining us today, and I hope I'll see you again soon. Thank you for joining us.